Yeah, people find most of their stuff by the internet now. They Google everything. Like YouTube.
So what are you doing right now, doctor?
So what we're doing now is we are just anesthetizing the patient. Okay. We're getting him ready for an extraction.
Wow.
And we are going to rid him of this infection that's growing over here from his broken tooth. Alright, so you're going to start to feel the lips feel numb real soon. And now what we're going to do now, while he's getting numb on this side, we're going to finish flushing him out with a special antibacterial mouth rinse. We're going to flush out the areas, flush out the pockets, flush out any blood clots. Okay? That's what we're doing here. We're going in the areas that have the deepest pockets. We're flushing it out.
Wow.
Yeah, we have people out there? People out. Oh, dizzy. Oh, I see. Okay.
My son is like, food, mommy.
Yeah. And look.
Oh, you having a baby. Wow.
I got a whole...
Congrats. You don't even look pregnant.
I know, I get it a lot.
How many months are you?
4, 18,
Oh, yeah,
6
yeah.
days, 7 days.
Yeah, not yet.
She's carrying it real
Yeah,
good.
that's how I was. 6 months, people didn't believe it.
Yeah,
That's a blessing.
well, I got 2 because we had a coupon, so I got 1 free.
Oh,
So it's a veggie patty. So if you want it, it's a 6 cent.
okay, you eat your own.
I ate mine already. If you want it, just
You hear she's eating a veggie patties, guys. She eats organic and healthy.
My purse somewhere over there. You'll see on my desk on the right. Look on it.
What advice would you give a person? You know, I liked your cosmetology section where you do cosmetic makeovers. Yes. You know, people that they have most of their teeth is gone, their mouth look like a train wreck, but they're just so afraid to come into the dentist's office. What would be your advice to get a patient in? Like a family member, a sister, an uncle, a husband, a wife, a mother, a daughter. You know, they have, this person in their family that just afraid, but they're losing all their teeth.
Yes. My advice to that person would be to think about how better you would feel to be able to smile and talk with confidence. Think about the times when you can wake up in the morning and feel how healthy you are, how healthy you are and how you have just a better overall feeling about yourself because you're able to chew your food properly and not get all of that gas and indigestion that you normally get from not having any teeth, okay? Because that's a lot of times what happens, People lose their teeth, they're not able to break down their food properly, and they still want to continue to eat the steaks and the pork chops and everything, and not chewing the food up. So you're swallowing a lot of those food particles whole, and then your digestive system has to work even harder to break those foods down. So just think how much better you would feel to not have all this gas, to be able to smile and talk with confidence, how much better you would feel to be able to go out and, kick it with your friends or go to, your parties or go to your church or your synagogue or where your house of worship and be able to, converse and be amongst people without feeling, that low self-esteem because you don't want to open your mouth. So think about those things. Sometimes you have to get past your fears in order to gain a little something better, okay? And so that's what it's about, And most people, I tell you, what they find is that it's not as bad as what you think. Those fears are just in your mind because of something somebody told you, or maybe you have a little fear of when you were a child, a little something happened with a dentist and you have a little fear there. But 9 times out of 10, 10 times out of 10, most of my patients, when they leave here, they say, you know what, it really wasn't as bad as I thought it was going to be.
Right on.
Right, Angel? Right. They're like,
what about that guy in the chair? How you feeling?
It wasn't that bad, right?
No. I
You needed it?
You got a testimonial right there.
That's right. Right on. Well, thank you, Dr. Verrett, for taking out the time to inform us about our health, which begins in our mouth. And what you said was so very important. I never even knew that when you lose your teeth, when you chew up food, that's why so many people get gas.
Yes.
And I know, like, I have several family members that have lost their teeth, and now I understand why. Because, like you said, they still try to eat the steak and the pork chops or whatever unhealthy food, and this is why they have so much gas and problems.
Absolutely.
You learn something every day, but your health begins with your mouth. You are an amazing dentist, and everybody in Miami, or people can fly in to see you because you're just a flight away.
Yes, I'm always here to help.
Thank you.
Just rinse off the me and then we're going to do this. Angel.
Almost out?
Yep, just about done. Yeah, we don't know what the first one. There you go. All right, go up there. This is
You took it out already?
uh-huh.
I didn't see it. You should show it to the camera. You did it so neat and cool. It's a little piece. You gotta show that to the people, girl.
Here it is. Just a little root tip there, a little piece of a tooth. Part of it broke off a long time ago, and this is what was left, a little root tip there.
Don't seem like it hurt at all.
Yeah, I heard.
Well, if you don't want to hurt, take very good care of your mouth, guys. That's the message. Brush 3 times a day.
That's right.
Well, there you see it, guys, on the H2B and Happy to be Nappy show, an extraction done by the best in Miami, Dr. Verrett.
Bloody hands. Ah.
Thank you. Positive affirmation.